Melody Foxx. I'm a clinical psychologist and a marriage family therapist, and also a certified equine mental health professional. And we'll be talking a lot more about that as we go along. My love of horses has gone back years and years and years, and becoming a therapist, it's wonderful to be able to meld the two together and be able to help my clients. And I do specialize in helping other people's clients. I do a lot of work with my own clients, but I like working with other mental health professionals and taking them out there doing the work and sending them back to the report to continue the therapy inside the office. There's a lot of things come up after the crowd, which I think definitely attest to. So, with no further ado, let's go ahead and make the timing here. No clock. Okay. I guess I'm going to be competing with the jackhammers. I wonder if they could take a lunch break for a moment. Anyway, let's go ahead and get started. Doesn't enjoy doing equine therapy, after all. I'm not going to see all that. So equine assisted psychotherapy, I consider it recovery for your heart and soul. And it is such a spectacular adjunct to the work that you do inside wherever you are working, whether it be a center or private practice, or if that's the only work you do with the horses is doing equine work week after week. That's very powerful in and of itself. So we're going to talk a little bit about equine history, the survival, and the senses. Now, horses have always had a very unique relationship with humans, whether it be working on farms or doing cattle drives, or carrying warriors into battle, or to transportation, or just for fun, just the afternoon, going out in the hills out here, having a good time. But unlike humans, horses are prey animals. They are strictly prey animals. Humans, as well as dogs and cats, are both prey, but we're also predators. And that's what makes horses distinctly different. They have to use all their senses in order to survive. Because instinctively, their entire survival depends on their ability to sense danger in their environment. And they utilize their keen sense of their smell, their hearing, what do they see, body awareness, and having that hypervigilance to keep themselves safe. And you may or may not have ever noticed maybe a herd of, I don't know, maybe on TV or in a movie or out in the field yourself, but a herd of horses, and one will move, they all move. They don't ask to stop why. Hey, what's that? What's going on over there? It's like, hey, somebody moves, they see something, hear something, smell something, and they take off, and that's how they survive. And that's really important. So they just do that, and they're just reacting to the horse that starts the movement when they take off. If one hears, sees, smells danger, they react. And that is very important for them. For human beings, a lot of times we are very reactive to the environment, and other persons are ourselves, and that's how we're similar. However, in our current world, we don't always take a moment to sense the perceived danger if there really is. We just react to what we perceive, think, feel, or believe. And that gets us into trouble. Sometimes we react by yelling or fighting, or maybe we drink or use drugs to cope with whatever's going on in that moment. And we put ourselves in unsafe positions, or perhaps resulting in problems in relationships and communicating. Like, why did my husband just storm out the door? What did I do? So they perceive something's going on and they react, where we need to really slow down and take a moment to figure out what's happening in our environment and react appropriately, such as people with anxiety disorders or perhaps personality disorders, or have a history of trauma and or abuse, maybe anger management issues or affect regulation. They need that moment to stop and pause and figure out how are they reacting to the outside environment before they get reactive. Take that moment to pause and probably use our own senses and do a lot of grounding work. Horses use their natural senses, which provide which provide powerful messages that will mirror back their direct experience with the humans. They are completely congruent and completely authentic in what they're experiencing in that moment. Unlike humans, we're always thinking about the past stuff, or we're worried about the future stuff. We're forgetting to be just right here, right now, in the moment. And horses, they don't deny or mask their feelings at all, and they see right through ours. And that's pretty magical when you're out there with your clients. That's okay. But, for example, I have one client who had an issue of not being able to find a relationship with a really nice person. And taking him out working with the horses in the session, what I had asked him to do is to pick a horse that he wanted to work with. He kept attempting to catch one of the horses, who proved to be very elusive, kept walking away, would not be captured whatsoever. And the client would try all these things, walking around, going right up to him, approaching slowly, and the horse would have nothing to do with him. And could not catch it at all. And at the time he was doing that, the horse specialist and I noticed there's another horse just standing right there, looking at the guy, just watching him do all this running around trying to capture this other horse. And she was just waiting for him to come up and, say, hey, how are you doing? I'll work with you. And then that horse walked towards him a couple times, and he just ignored it, just kept walking, trying to catch this one horse, and just really focused on that. So during the processing part of the session, we brought it up that he had noticed that were there any other horses in there that might have been more approachable, that he might have been able to capture. And no, I didn't really notice. And we're going, really? It's like, well, do you see that one right there? She was standing there the whole time, just waiting for you to come to her. And it was at that moment we went, aha. That makes sense. And we're going, does that play any part in any other area of your life? And go, well, I'll go to a bar and I'll see some really hot chick on the other side of the room, and I'll want to go get her, but there's all these other girls going, hey, what about me? He completely avoids those that are available and open and making themselves vulnerable to him, and goes after the elusive one for whatever reason. And that was a client that was visiting from another state, so I wrote up a report, sent it back to his therapist back there so he could continue the work on why he always goes for the elusive ones and wondering why he can't have a relationship. That's very nice. It's really amazing how these things play out. So, I guess I'm still that. So another client, I'm going to be giving examples here too, and I'm sure you guys have lots of examples, I hope you do. But I've had clients be very disconnected with their verbalized subjective feelings, their verbalizations and their affects in an office setting, and they just don't see when we talk about it there how it's coming across. So I take them out to go work with my co-therapists, which are the horses. And that incongruence is often demonstrated, and that's where the client could really see for themselves how what they're saying and their behavior don't match whatsoever. I had one client, for example, who had a severe history of abuse, and while she was standing there stroking this horse's mane, her affect was very calm. She was almost smiling. I think it's the first time I've ever seen her smile. And her body was very relaxed, but the whole time she's verbalizing it. I hate red hair. I just can't stand anyone with red hair, and I hate red hair. Well, my co-therapist, the horse, had this beautiful red mane. It was a completely red horse. Why she picked it, I don't know. But during the processing part of the session, the client was able to identify who had had red hair in her past, which was an abuser, and became more aware how what she says verbally along with her nonverbal behavior that it's interfered with her current relationship with her boyfriend who has red hair. So all of these give and takes and miscommunications, she's saying how much she hates this and that, but then her body language is completely different and not congruent. So she was able to gain some awareness that maybe she needs to remember, he's him, that was the past, my behaviors and my words need to match here if I'm going to have a successful relationship with my boyfriend. Another example is in working with a family. I had a father, mother, and 3 adult daughters, and it was really interesting to find out why everybody picked the horse they did, because a lot of times we'll let people go scatter and find their own horses. I have 5 or 6 horses with the crowd I work with, and with families or bigger people, or bigger groups, they get to pick who they want to work with. But the father took the really big horse. Then 2 of the daughters picked horses that kind of looked like them, same color, same kind of attitude, and the way they walked and all that. It was pretty funny. And the mother picked the baby horse. And the 3rd daughter picked a really elusive one. She had a really hard time catching it. And although the 3rd daughter was able to eventually catch this horse, she was having a hard time kind of controlling the horse. And the father decided to come to the rescue, we noticed. He gave the 3rd daughter his horse and took the one that was a little jumpy. And then another exercise we did following up that, the father was so busy watching what his daughters were doing and the wife were doing with his horse. He wasn't paying attention to his horse. We're all about safety, so we're not going to let him get hurt, but he put himself in a lot of unsafe positions by being so focused on what everybody else in the family was doing and not taking care of himself. So during the processing part of the session, it came up that the father was the one that was always rescuing everybody and his adult children, even when they didn't ask for it. And this created a lot of issues between them, a lot of conflicts between the adult children and feeling like the father didn't trust them to make the right decisions because he'd always jump in and rescue them before anything happened. And so that created quite an awareness, and we went on to do a lot of work where he was able to back off and learn to focus more on himself and take care of himself, because that is so important. His adult children, he did his job with them. And he could be there if they asked him, but take a step back. But they wouldn't have gotten to that in the therapy room, but they were able to see it play out with the horses, and that's what makes it really special. So like humans, horses are herd animals, and they rely on others for safety and survival. Therefore, our clients interacting with horses either individually or in groups are provided an opportunity to work on the dynamics that are related to relationships or isolation or asking for help, and their role in the human herd and the role in their family. However, unlike most humans, horses are always fully present. They're without judgment, and they don't have an agenda for themselves or for other people. And this is what, in part, makes them the perfect co-therapist. Because even as human beings and as therapists, we always have our own ideas and thinking about what we're going to do next, or if they do this, or what have you. But horses are just there in the moment. So, origins of equine assisted psychotherapy. Well, equine therapy provides clients with skills of patience, self-confidence, trust, and compassion. And horses weigh typically anywhere between 800 and 2,500 pounds. And learning to trust such a large and often intimidating animal, we've talked a little bit earlier about experiences like that, often requires patience, skill, and confidence. So it could really build a lot of confidence to encounter and work with such a large, massive animal. And by the way, like a horse specialist and a mental health provider, the horses also must go through training with clients in order to be certified as a certified therapy horse. And they must complete a minimum of 1,000 hours and pass field tests. And just like therapists working on their hours, therapy horses must pass a basic test before even working with clients, because there's certain temperaments. We don't want horses that kick a lot or bite or nip, because we're always looking at the safety of our clients. And then work as interns until they get their hours, and once they get that, then they have to pass a certified and field test as well. And I think that's important just for liability too when you're working with horses. Some people say, oh, I have my own horse, I'll just take my own horse out and do it for therapy. But you really want to make sure it has the right temperament and it's not too wild. It can handle being touched in all sorts of places in all sorts of ways. So equine therapy originated as therapy for physically disabled individuals, and it was designed to improve the balance, muscle strength, and flexibility. Equine therapy extended to those with mental and emotional disabilities to increase their patience and self-esteem. An Equine Facilitated Mental Health Association was formed to promote equine therapy and educate other professionals such as ourselves on all these practices. And now has become a part of many addiction recovery, eating disorders, and wellness programs. These are two of my horse specialists. Tina is on my right, and Marissa's on my left, the soul. And we have there, oh, we have Tango, the little one. I work with them. Tina and I, we have a place up in Menifee, and we do a lot of work out there with clients. Clients come out. My private practice is in Newport Beach. It's only an hour and 10-minute drive, so it's a really easy get through there. And then Marissa just moved for Topeka Canyon over to Carbondale and Orange. So animal-assisted therapy has been endorsed by the American Psychological Association and by the Equine Assisted Growth and Learning Association, which you might have heard of as EGALA, as a viable option for self-exploration and growth. And there's a lot of different acronyms. So as you can see, EAP, EFT, EAT, ECT, EAL, probably the list goes on. So I think it's important to distinguish a little bit between horse riding and equine psychotherapy. The focus of equine psychotherapy is not on riding, it's not on horsemanship. 90 to 100% of the activities take place on the ground. And no horse experience is necessary. In fact, working with anxiety disorders, I like it when they've never been around a horse and I have to put them in a stressful situation where I can see how they act and react and give them a positive experience to work through that and face their fears. It's experiential in nature, where participants learn about themselves and others by engaging in different activities with the horses and then processing those feelings, their behaviors, and the response patterns that tend to emerge during the sessions while they're working with the horses. So as well as my co-therapist, horses, a licensed and certified mental health professional works along with a horse specialist. It's really important to have at least 2 people there. You could be a horse professional, could be your horse, it could be the mental health provider, but if you've got a client that walks this way and a horse walks that way, you can't really watch what both of them are doing at the same time. The horse specialist's job is to know the horse, watch the horse, make sure everybody's safe, but also watch the behavior patterns of the horse and how that horse is responding to the human being. The mental health provider, on the other hand, is focused on the client and what the person, the human being, is doing, how they're acting and reacting to the horse. And then together, we work as a team together to help process with the client what we see out there, what they see and experience out there. So the horse mirrors what's going on in the moment. The mental health professional observes, processes the actions and reactions of the client. And the horse specialist observes the actions and reactions of the horse. And together we work as a team, all of us, the horses and myself, to assist the client to increase their own personal insight, which can then be taken back to the therapy office for further exploration and or into their relationships, either with themselves or within themselves or with others. So I can't really go back on that, but just to go back on the EAP is an acronym for Equine Assisted Psychotherapy. EFT is Equine Facilitated Therapy. EAT is Equine Assisted Therapy. ECT is Experimental Counseling Techniques, and EAL is an acronym for Equine Assisted Learning. You may also have heard of hippotherapy, which came out a long time ago, which is another form of physical therapy, which works with clients, say, with cerebral palsy, and again, works with them on the horse, sitting or lying on the back, working with movement balance for that therapeutic effect and building up strength. So, let's see. I don't know which one that is. Okay. But what I do is I focus on the psychological and emotional needs of the client. I utilize this very effective and very powerful approach, therapeutic approach, to address a variety of mental health issues and emotional and psychological developmental needs. And it is used to help people identify problems and overcome obstacles in their life and find their own path to living the life that they want. And although this modality can be used independently from traditional office therapy, I found it a wonderful adjunct to doing office work and providing areas for continued growth with the client once they get back into the office. So this is Tabitha and Tango, mother and son. And horses' senses are really astute in that they always seem to know what our clients need in that moment. And I had a client recently that had moved from the East Coast back to the West Coast, and she presented with depression, anxiety, trichotillomania, and her perception in life was that she had lots of friends and always had lots of friends. But her history, as we dove into it, supported that she was always doing everything for everybody else. She was buying them concert tickets, paying her boyfriend's bills, paying for dinners, doing everything for her friends in intimate relationships, and she was being taken advantage of. and never getting her own needs met. So at one point during one of my first sessions with her out with the horses, the client had this verbalization of a realization that she never did get her needs met. And she went on to say that nobody's ever had her back. And right at that moment, these two, Tabitha and Tango, came up, put their heads right on her back and supported her. You can't orchestrate that. You can't ask the horses to do it. They just instinctively knew she needed support on her back. So we were able to sit there and let her process what it felt like to have someone have her back for a change. And subsequently, she made a lot of positive changes in her life to get more balance with her relationships and set up better boundaries, etc. But when they came up and put it on her back, it was just so beautiful to observe, and that the co-therapist knew exactly what the client needed right at that moment. And that's kind of part of the magic and the beauty and the spirituality, or whatever you want to call it, of doing this kind of work. So, very nurturing. So who are helped? Well, individuals, families, couples, groups, veterans, and it should be stated, by the way, that the VA has highly approved of doing equine-assisted psychotherapy. They find it very powerful and very positive work in supporting veterans who are coming back, particularly with PTSD. It also works great with those with anxiety disorders, which is my specialty, and working with stress, obsessive compulsiveness, panic attacks, eating disorders, agoraphobia, life transitions, making a lot of changes in their life, such as jobs or moving or marriage, divorce, relationship problems, or loss of a loved one, or empty nest. I get a lot of women going through life transitions when their teenagers get up and go out into the world. Also those with difficulties with relationships, and that probably goes without saying, and depression, I forgot how many times I have to tap this, abuse history, and those in recovery. So how does a client feel when not being included? How would you feel if you were standing here and everybody's on the other side? You're not even paying any attention to you at all. Do you feel left out? Do you feel isolated, unwanted, not important? A lot of our clients, especially those in recovery, feel like they're all alone in the world and nobody wants anything to do with them. So it's nice when we get the therapists and the clients to turn around and interact with each other and really develop that. So we're talking about, okay, comes up later. Difficulties with relationships. We're dealing with issues of commitment, trust, possibly anger management, codependency, communication issues, not being able to set appropriate boundaries, maybe family disconnection, and team building as far as if you're working with people in corporations. This works really well when you've got team members that are just not communicating and getting along. Working with those with depression, abuse, and recovery, you're dealing with the specific issues of trust, coping skills, self-esteem. If you're dealing with people in recovery, maybe relapse or cutting and affect regulation. So what we want them to do is to learn to be part of the herd, to be accepted and respected, and have that go both ways. So the horses will come back to you. Oh, you know what? This is, I'm sorry, let me escape this for a moment and start this over again. Yeah, this is a very low volume, but
I think it's a really powerful modality that to be used with clients who have difficulty finding words to express how they're feelings, because it's a very powerful tool in breaking through language and really getting into the heart of issues that people are dealing with.
For people with high shame, people who are perfectionists and have a great deal of shame and tend to hide their mistakes. And I say this because in working with the horse, you're going to make mistakes. However, because there's no conversation, there's less shame. I'm remembering a quote from the 4 Agreements book I was listening to. It talks about how animals in the wild, they make a mistake, they pay for it once. Human beings make a mistake and we pay for it for our whole life. And then we get other people to help punish us too, over and over and over. When you're just working with an animal, you get to bypass all of that stuff. You make a mistake, the animal, you do whatever you do, and then you move on. And there's the animal doesn't shame you. And because you have to move on, you move on.
Learning that they could have success also, and trusting them and feeling very confident in the end about themselves.
And those are just 3 therapists in the neighborhood that went out for a demonstration and experienced it for the first time themselves and what came up for them on that. So one of the things that we do, that's TJ with Levi, obstacles often get in our way, and we create our own obstacles that keep us from moving forward and connecting with others or accomplishing our own goals and dreams to create the life that we want for ourselves. So EAP helps us learn to trust ourselves, to navigate through these obstacles, and continue on our path in life a little bit more successfully. And these are 2. I think where I'm at here. So how EAP works. In the right spot here. So we work on a lot of different levels. One of the things we like to do, well, safety is always first, so that's, that's a given. We're always working on safety. But we identify the zones, and to do that, I'll use you, Yvonne, since you're right. Get on here. So we want to identify the different zones and how we're interacting with other people, and our nonverbal cues play into verbal. I'm going to have you stand over there for a second. So basically we have different zones of the animal. And I don't have a long picture yet, but basically the first zone is the greeting zone. We want to train people on how to approach a horse, which is the same thing you do to approach a person. You go, hi, how are you? I have no weapons in my hand. And if you were a horse, you'd come up and smell and make sure you're okay, and then you start engaging in that comfort level with the horse. You could stay there for a moment. Okay. Using that's also the greeting area could also be what we call the stop zone, where if you stand in front of someone or something, they can't go by. The horses don't want to run over you. Now your teenager may want to run over you, but most people don't want to do that. But if you're dealing, say, with a teenager, and I have a door here, and this is my kid, and I'm saying, go to your room and go clean up your clothes right now. What am I doing? I'm standing right in her zone, not letting her go forward to do what she needs to do. Whereas if and that's putting a lot of pressure on our loved one or whoever it is that we're working with. But it also does it with the horses, so it plays that out there. We're saying, well, we want you to go this way, and we're standing in their way. They're not going to be able to go anywhere. That was the previous picture. Where she was being an obstacle. So you become an obstacle to that other person too. So you want to release that pressure and kind of open up, say, okay, go to your room now and go clean up. That's what I want you to do. And so you leave it open for a pathway. You don't go in their stop zone. The other area is the motivation zone, which is, stand on a second. So if I want them to go forward, I may want to go behind and go, come on back, let's go on over, come on, let's go. And we do the same thing with the horses. The motivation zone's from the middle of the horse back, where we want to just kind of push them forward. We don't want to stand right behind them because they cannot see behind them, and they don't know always what's there. And nobody likes anybody to come stand up, because if I were to come stand up, like, you kind of know me, so if I was to stand here for the longest period of time, I'm just probably going to start to feel a little uncomfortable. Even knowing you. I know. But it is a strange feeling. So these are some of the exercises we do. You know what someone's thinking, or they don't know what's there. They're going to protect themselves. They're just reacting to what they feel in the environment. They feel that pressure. They're going to react to it. So, like if I wanted to get to know you and I came up right behind you or stood really close to your space, they're going to go, wait, I don't want to be near you. So let's not do that. So we have the different zones, the relationship zone, and then the neutral one of opening up. The best part is, I think, is the relationship zone. That's when you build up that trust. That's where you're standing right next to the animal, between the head and its heart. I call it heart work because you're standing kind of heart to heart with that horse. And a lot of times they trust you because they really can't see you unless they turn back to look at you. And they have to trust that you're safe and you're okay. Just like in a relationship, if you don't know somebody very well, you're not going to stand shoulder to shoulder with them walking down the street. But the more intimate and more safe and more trust you have in that relationship, the closer you're going to stand to that person. And when people don't have good boundaries, this plays out there with the horses, and it can really demonstrate for them the importance of being respectful, giving space, appropriate boundaries, and communication on what you want. Let's see. So what we do is we give the clients a task. There's no right or wrong. There's no good or bad. There's no judgment on what they do and how they do it. I have people put bridles upside down on the head, wrap scarves or belts around them, trying to get them to move. It's like, whatever goes. And they'll ask, is this the right way? It's like, well, just tell us when you're done. And they'll go, well, the horse looks really sad or hurt. Well, why would you say that? And the horse is sitting there going, I'm fine. And they're coming their way. Carrots and apples are a great distraction for horses. And they don't always want to listen, just kind of like kids in the candy store going, ooh, I want this. I don't want to go eat my spinach first. But you have to get the horse to eat their spinach, so to speak. So EAP works on the communication in the moment, and in a moment I'll discuss more about verbal and nonverbal communication. We identify clients' strengths and the incongruencies, and it helps with insights a lot. So, helps with insights. So let's talk about, we talked about that, verbal, nonverbal. So our clients' lives play out with my co-therapists, which are our horses, make it easier for clients to see what's going on in their own life and how things play out there. Now, studies suggest that humans use anywhere between 83 and 97% of nonverbal communication with others. That is huge, considering how much talking I'm doing right now. But only 10% of our communication is verbal, and the rest is nonverbal communication. So when you have somebody, this works well for a lot of ladies, I found out. You hear from the men, oh, I love you, you're the most beautiful person in the world, but they don't call on time, they don't show up on time, they don't do all these other things. It's like, what are the behaviors doing in their verbalization? They don't match. And also for yourself, do you match what you say and what you do? I was always told, say what you mean and mean what you say, and it goes to act what you say too. But some studies go a little bit further in breaking it down to the verbal words are only 7% of our communication. Our body language is 55%, and the tone of voice of which we speak is 38%. Do the horses care how you talk to them? No. You can say, hey, bud, or hey, bud, or what's up, or I don't like you today, or whatever, you be angry, whatever. They don't care. They're not going to respond to what you're saying or even the tone of your voice. What they're going to respond to is your nonverbal communication, your body language. That's what they respond to. And whether or not we're conscious of it, human beings respond nonverbally as well. So hopefully the volume is up on this loud enough. Oh, actually, no volume is needed here. We're going to watch a couple different people go through some exercises. And just pretend you're either a horse specialist or the mental health provider, and just notice whatever you notice. And he's never been around horses before, either. And his task was just to take the horse in one direction, come back around and go the other direction. And then tell us when he was done. Just standing there kind of talking to the horse. seems like a pretty simple task to do, right? Just walk the horse one direction and walk it the other way. But what was interesting is watching him as the mental health professionals, watching how he was interacting with the horse. So did anybody notice anything? Looking at people that do this work?
He did seem to have a sense of direction at first. He was walking backwards in front of the horse.
Okay.
He seemed to be patting and touching and being affectionate with the horse, which I think would probably help.
Yeah, build that relationship, sure. Any other things noticed? Or
Leading. He kind of would walk and then look back to see if the horse was.
Sure. Yeah, he did all those things, and I didn't know anything about his history. He's just like you, another professional came out for a demonstration. It was nice enough to let me use him as a guinea pig for my presentation. But what's interesting is he was out there, he's trying to coax the horse, talk to the horse, and I said, well, I noticed you stopped in the middle of the circle, and what was that about? And he said, oh, I just wanted to make sure he was doing okay and everything was all right, and, you know, just checking in with him before I kept going. You know, what was interesting was the later find he's a father of 3 little girls, and a mother, and not the mother, but his wife, mother of his 3 girls. He's very nurturing, very kind. He's always concerned about everybody else. So, but we didn't do a lot of processing because it was a demonstration, but I suggested he may want to work on learning, kind of like that father earlier, taking care of himself and being focused on what he needs to do and trust everybody else will go along with him. So, yeah. Now, this other lady, Jamie, another therapist, her task, I had 2 sets of cones, and her task was to walk through the first set of cones towards a goal that she wants to complete, and the other cones represent the other task, and was to get the horse, just walk it right through to the other and let us know when she's done. And we'll see what she does. You can see the first set of cones. So she's talking, saying over there. Yeah, that's what it looks like.
The horse is leading her.
Like, we didn't do what we're supposed to do, but the horses tell the tale, right? The tail tells the tale. And so she was done. So what did you notice on that task? Anybody? Any observations? What was that?
I said the horse told her.
The horse told her?
Control, yeah.
Okay. Yeah.
Well, when somebody's trying to give some type of advice or point that they don't know what they're doing, they're wasting your time, so you might as well actually show them.
Yeah. The horse didn't show them either. Yeah.
She allowed a lot of distance between herself and the horse with that lead rope, and I wonder about her boundaries, her personal boundaries in life. She wasn't getting close enough to that horse to actually direct the horse's movement. You have to really safe distance from the animal.
Very safe. This is her first time around horses. She's terrified of them. But she did really good. And you'll hear her talk in a moment about the experience. But I asked her at that point, so are you done? Do you feel successful? Yeah, I feel successful. Did you complete the task? Yeah, I did. I've known her for like 20 years, so I could talk about her. but it's keep it there. But anyway, I did suggest that she has a goal. She's been working on her dissertation for 7 years. The only thing keeping her from getting her doctorate is that stupid dissertation. So that was her goal, was to complete that. So I'm just wondering what obstacles or what fears or what other things are keeping her from just doing that last thing to get through to the next goal that she wants to accomplish in her life. And that's how it plays out. It's really, really interesting. If I was a therapist, I'd go and process all this information for her. But, yeah, I'll just tell her as a friend later on. But it's, working towards those goals, but it's really amazing how the horse was not going to have anything of it. Her communication wasn't very good. She wasn't directed towards where she wanted to go. If she had, she would have gone, okay, let's just go. Let's walk on through. And the horse probably would have done it. And what was interesting, when she turned to come back, the horse was going, wait, I'm not done. We're supposed to do something else? But I love that negotiate. Come on, let's go over here. Let's go. So anyway, I thought that was pretty interesting on that. So, looking at time here, we're doing good. So, overview of some of the benefits of equine assisted psychotherapy is respect of themselves and others, improved communication and social skills, boundary setting, learning how to do that, learning empathy towards others, self-control, confidence, and we're looking at, well, go over here. Overview. Continue responsibility and accountability for what you do, problem solving, cooperation with other people, other horses, overcoming challenges and obstacles in a very non-threatening atmosphere. Also building up honesty and trust. One of the horses you saw a picture of earlier, Levi, he's amazing. He resides over at Newport Academy and working with the kids. And there'll be somebody going in there, no, I haven't used drugs, nothing ever happened to me, and the horse's tail starts switching. Liar. Or somebody will say something and the horse will go, no. And it's like, well, does the horse like to agree with you? Well, okay, maybe I do. And the horse will go, yes. And it's like, you can't train them. They're just amazing. Watching, that's why it's important to have a horse specialist that really knows the horse and understands the body language, because each horse has their own telltale sign for them. It's really interesting. So, I don't know what slide I'm on yet. Anyway, but when we're talking about confidence, we're talking about learning mastery of a new skill, which you definitely can learn new skills out there, and increases the client's confidence in their ability to take on new projects and challenges such as recovery, and may lead to improved self-esteem. When we're dealing with problem solving and creating freedom for themselves, many people have been emotionally inhibited or over-controlled in their lives, may have lost some measure of that spontaneity or locus of control. The spontaneity of participating in the tasks and activities that are going on can help restore their ability for healthy, healthy participation in their own life and recreation and play by being more creative and completing tasks that they do. They learn more self-efficacy by learning to communicate, and creating more harmony with a horse may help promote new or renewed feelings of efficacy. And being able to be successful with the task can replace clients' feelings of learned helplessness and the lack of motivation to empowering the client to take on challenges in other areas of their life. They learn communication skills as nonverbal versus verbal. As mentioned earlier, horses are very sensitive to nonverbal cues and nonverbal communication of others, thus it helps assist our clients to developing greater awareness of their own emotions, their own nonverbal cues, their body language, that they might be communicating to somebody else, and the important role of that nonverbal communication in their relationships. Working with their own self-concept, and working with the horse through a simple increase of awareness of their human size in relationship to the horse, clients can develop a more realistic view of themselves in the world. This works really well with those with interpersonal aggression problems, and also treating those with eating disorders. And we're working on trust. While working with horses, clients learn to trust. That's huge. Not only with another person, another animal, but also with themselves, to trust that I could do this, I could accomplish this, I could work through this, and it's going to be okay. No matter what I'm feeling, it's going to be okay. This experience can help aid in the development or restoration of trust, especially for those whose ability of trust has been limited due to a very difficult life experience, such as abandonment or neglect, abuse, or marital infidelity. Anxiety reduction works great for that, and although studies with that human-animal interaction have indicated that contact with animals significantly reduces the physiological anxiety levels, heart rate, blood pressure, etc. The interactions with horses that may bring on that initial fear just by the sheer size of the horse, but the horses quickly help minimize these fears as they tend to be very authentic, genuine, nurturing, and very much in the moment. And so it really helps with the clients learn that affect regulation. Decreasing isolation. Now, horses have unconditional acceptance, and it provides clients with a very non-threatening interaction which can be transferred into their daily interactions with others, and it especially works well with those, at least in a long-term history of feeling rejected by others or feeling different from others, or maybe were victims of abuse at one time. Perspective, giving them a better perspective, working through grooming tasks. You might have them a brush and do grooming tasks, allows them to focus on something other than themselves, helps developing that empathy and that nurturing and caring towards someone or something else. It directs their attention and interest outside, and working with a horse is outside towards a more safe and caring interaction, and then they can transfer that onto the relationships in their own lives. Self-acceptance, they're working on self-acceptance. So while engaged in some of the tasks or activities, clients can observe the comfort of the horses in their own bodies. And clients can often take this experience back with them in their own lives, and their fears of embarrassment in public are often reduced, or they have increased self-acceptance as they're watching other people's body language and learning not to take it so personally. It's just what's going on there. Social skills, clients who may be socially isolated or withdrawn, they have a positive relationship with the horse is often a safe first step towards practicing their social skills needs and to initiate closer relationships with other people. Boundary setting, that's huge. A lot of boundary setting issues come up working out there. But with clients who have experienced prior abusive and control relationships in particular, the healing really could take place as the clients discover that setting appropriate and respectful boundaries with such a physically powerful animal is tremendous in their self-esteem, and that they have a voice and they can speak up even non-verbally to say, hey, that's not cool, we're not going there, stop walking into me, go away. Walking into me, go away. Each horse typically operates within the boundaries of their hierarchy of the herd, which is a very mutually respective relationship. So also when working with families of those in recovery of any kind, they learn to set appropriate boundaries, because of what you find in a lot of families, in recovery, there's no boundaries. There's a lot of enmeshment, a lot of inappropriate support and boundaries. So they learn appropriate boundaries in the family setting, seeing how they play out, and are supporting the drug use or whatever, or the behavior of the person, their identified client, I guess I should be saying, or identified patient. So they learn to set appropriate boundaries and not fear causing the client or that person any positive or negative reactions or actions, and they are not the cause of them speaking up and going, hey, no, we're not going to do drugs in the house anymore. No, it's not okay for you to have a car. We're not paying the insurance as long as you're using. Forget it. You can do that. It's not going to make them go out and use more. If they're going to go out and use more, they're going to use more, right? So, and also helps with that codependence. Assertiveness and learning to effectively communicate with the horse requires the client to demonstrate assertiveness, a direction, which my friend talked a little of there, initiative, and other important skills that enable the client to express their own needs, their own wants, their own desires more effectively in their relationships and back in their own lives. Works with impulse control for those clients that have experienced difficulty with control over their impulses. They need to communicate calmly and non-reactively to the horse, and that promotes skills of more emotional awareness, regulation, self-control, and impulse modulation. Plus, the research clearly indicates that animal-assisted therapy reduces client agitation and aggressiveness and increases cooperativeness and behavioral control. So, yeah.
The exercises were great because it brought a lot of insight. Some of the insight was about trust and boundaries, and that we need to make goals, of course. I'd like to do it again.
Most people like to do it again. But it really does help in setting and maintaining boundaries, or not in your life. You can make your decision. But also develop that trust in yourself with others and creating goals. So, what does this horse say non-verbally? Good little baby. He was just nuzzling up. I couldn't help but take a picture of him. But if you are doing this kind of work in whatever space that you're doing it. It would be great for you to be doing pre-test, post-test with your clients. There is not a lot of data and a lot of research out there. And we really need to get a lot more data, a lot more research on how beneficial this is and how it changes our client's life. Because it would be great if this became a more evidence-based practice, but we need to show more evidence. So it could be more, well, more reimbursable, more respected, and we could utilize it on, I think this would be the greatest thing in the world to just do this all the time. But there are some studies out there that shows decreased feelings of depression per self-report, work with at-risk youth, people perceive that depressed adolescent clients improve self-esteem, self-efficacy, and decreased isolation. Bereaved children increases confidence, trust, and self-esteem. Significant decrease in anger, especially in special education boys. I work a lot of them in the school district, and they would do great with this kind of work. Unfortunately, I can't take them to the schools. Reduction of regret, guilt, resentment, fears for the future, enhancement of self-support and independence in adults and residential programs, and that's after 28 hours of equine-assisted psychotherapy. Significantly lower scores on aggression. I'm just kind of going through this real quick because I only have about 8 minutes left. But significantly higher scores in self-esteem and locus of control measures, which is really important when you're dealing with, it's them that make me do everything. It's because of them instead of, oh, I'm in control. I'm choosing to do this or not do this. I'm choosing to use or not use, or whatever the case may be. Improved GAF scores, but I guess as of October, those are no longer in play. Or 2014, they won't be in play. Self-report on outcome questionnaires, improvement in depression, disassociation, life functioning with women with PTSD, and again, those scores on aggression. So basically, I think this is Goldie. Goldie. And this is just learning to reach out and touch. It's about connecting and building those relationships and building that trust. So clients are able to experience EAP in a very safe and non-judgmental environment, process and take back to their primary therapist new insights to be worked along with them. It's important here. This is huge, and it's becoming a more political issue in the politics of equine work at all. But work within your scope of practice. That's really important. If you're a licensed mental health provider or an intern working under someone, then process. Go for it. Do your therapy. If you're a drug counselor, work within your scope there and deal with the aspects that come up that maybe deal with drug use or not, using or not, or boundaries or not. But so much comes up with clients out there, it's probably important to realize when you need to refer back to the primary therapist so they can process deeper. Because I find that there may be problems coming down in the future if you don't work within your scope of practice. Most utilize at minimum 1 horse specialist and 1 mental health provider. Egal, I think, wants 2 mental health providers and a horse specialist. If you're working with a large group or a family, add more facilitators. Because it's hard to keep your eyes on what's going on with everybody there if you're only one person. So training, if you're interested in continuing training, the OK Corral series. Greg Kirsten is the founder of Equine Assisted Psychotherapy, and he's actually doing a session with Tina and I doing a training up in Menifee next weekend. But he goes all over the country and does trainings there. EGALA training schedules, you can go on egala.org and get their information. You can go to pegasusect.com for information there. And also for certification, you have to go through an approved and appropriate training. Plus continuing education trainings are really important. And then you can check necpet.org for criteria needed for national certification. Or as I put there, you can utilize my services as a tool in your toolbox. As a very individual therapist, I do like taking clients out there that aren't my clients. I know nothing about them. I go out and do the work. I write a report and send it back to their therapist so they can continue to work with where they're at. So I did want to leave some time for some questions. If anybody has any questions, that's me, Annette. Just how you find it. So anyway, I'll skip there. So. Right out there. I also wanted to say, Tina and I often do demonstrations, usually on a Wednesday or a Saturday for those that are interested. It is a little bit of a drive, but it's definitely worth it. If you would be interested, we're going to pass around a sign-up sheet. I can let you know when the next demonstration will be. And that's you doing the work. Because really the only way to experience what our clients experience is to go out and do it yourself. And it's fun. But we don't get into a lot of processing out there. If stuff comes up for you, we'll probably say, that would be good to take that time. Or your supervisor, yeah, exactly. So, did anybody have any questions so far? Yeah, so y'all got it, right? Yeah, so, yeah.
What was your experience when maybe the horse doesn't take too well to the client? Is that experience that you've seen anything like that?
Occasionally, well, like the one that was being really elusive, but generally, generally we schedule like an hour and a half for each session. But sometimes we might get out there and 5 minutes later, we did all the work we're going to do that day. But if the client is not able to engage with the horse doesn't want anything to do with the client, then oftentimes we'll ask, well, what's going on with you today? What's happening? What are you experiencing right now? Has anything happened last week or last night or whatever they're bringing into the crowd, because that's what they're experiencing out there. The horse is not engaging for some reason, and we just want to figure that out. What's that?
Is there something behind it?
Oh, there's always something behind it. Yeah. And we just work on that, on what's going on with the client. Why do you think this horse who's worked with you for 6 weeks doesn't want anything to do with you today? What's happening? What's up with you? And also, what is it like to have a horse not want to work with you? That brings up a lot too. Nobody wants to play with me today. So, any other questions?
Oh, it's kind of like the typical number of sessions.
It varies. It depends on what they're going through. I could go out there and we do one session, and that's all they need to get what they came out for that aha, or to move on in therapy or whatever they're doing or take to the next level. Some people do 6 to 12 sessions, some do 20. It really depends on what's going on. It's very powerful work. A lot of processing. I have a lot of people journal. They say journal. The stuff's going to come up for you. They'll leave sometimes going, I don't know what happened today. I don't know how this applies to my life. And I see them 2 weeks later and go, oh my God, I couldn't believe that happened. Same thing the horse did to me, my friend did to me. Gee, I wonder what happened there. What was going on?
So you charge for like a block of the number of sessions?
I do it by the session. It depends what horse specialists I'm working with. Different people bill separately. Because I take insurance as a private practice person, if they're on insurance, I have to do things differently and separately. My horse specialist has her fee as well as the horses because they're working too. Not going to leave that on that. So it's, it varies. Or if they're cash pay, I have one fee, and then it's broken down between the horse specialists. And that's the other thing too. If you're a mental health provider, your horse specialist is just as important as you are. It's really important to, how much you know? Oh well. Nobody's above the other person out there, because sometimes some mental health providers think, well, I'm the licensed person, and the horse specialist is just watching the horse, but no, you're all working together as a team. You're all equal out there, and you have to treat your horse specialist as such as well. It's important. And paid too, is equitable.
How long is a typical session?
Some people do an hour. I do an hour and a half. Because by the time I go through all the safety and the zones and all that, and kind of go through some of the basics of it, it takes a few minutes to get out there, and then having to pick out the horse if they want to go get it. We're pretty fluid. We've been known to do like a 2-hour session before with a family, 2.5, but it will go. we probably should stop it a little bit sooner sometimes, but everybody's on a roll and everybody's happy. We're doing work and it's great. So I could do it all day. It's a wonderful modality. So I encourage you, if you're interested in doing that, to check out the trainings. Get appropriately trained. They're appropriate supervised. Make sure you work with a horse specialist that is there. There is insurance too to be had for this work. It's few and far between. But if anybody's interested in insurance companies that will give insurance for doing equine work, I can give you some names later on. So anyway, any other questions before we wrap up? No? Okay.
Thank you.